In this video, you will learn when ginger, usually considered a beneficial spice, can become a threat to your health. Although it is often seen as a natural remedy, in certain situations, it can lead to serious complications and even put a person's life at risk. We will talk about 10 situations in which ginger can be dangerous, especially if you have certain health conditions. This information can help you protect your health and avoid a potentially fatal mistake. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Stop consuming ginger immediately if you have problems with blood circulation. The much-praised blood-thinning properties of ginger, due to active compounds like gingerol, can become a double-edged sword for people with circulatory disorders. Although ginger is known as a spice and a herbal remedy, its potential effect on the natural blood clotting process raises concerns for those prone to excessive bleeding. Ginger can worsen this condition. Today in the United States, more than 3 million people suffer from various blood clotting disorders, with approximately 20,000 individuals diagnosed with hemophilia and about 1 to 2% of the population taking anticoagulants on a regular basis. For these people, consuming ginger poses a serious risk, as it contains compounds that inhibit platelet aggregation by 40 to 60%, which is comparable to the effect of low-dose aspirin. Among patients with clotting disorders who consume ginger regularly, approximately 7 out of 10 experience an increase in bleeding time by an average of 3 to 5 minutes, which becomes critical in cases of injury or surgery. Consulting with medical professionals is essential in order to receive personalized recommendations that are tailored to each individual's health condition. Stop consuming ginger immediately if you have diabetes. While ginger may have potential benefits in lowering blood sugar levels, it also presents serious risks for people living with diabetes. A sudden drop in blood sugar levels can lead to a range of problems, from dizziness to fainting. In addition, the interaction between ginger's blood-thinning properties and diabetic conditions can create further complications. In the United States, more than 37 million people, which is approximately 11.3% of the population, are affected by diabetes. Around 90 to 95% of them have type 2 diabetes. About 85% of individuals with diabetes take medications to control their blood sugar levels. Ginger can reduce blood glucose levels by 15 to 20% within 2 to 3 hours after consumption, which is particularly dangerous for patients who are already taking hypoglycemic medications. According to statistics, 1 in 5 people with diabetes who consume ginger regularly experience episodes of hypoglycemia that require emergency correction. Furthermore, in 30% of patients with diabetic nephropathy, ginger may worsen kidney damage due to its ability to increase renal blood flow. People with diabetes need to monitor their intake of ginger carefully, taking into account potential complications such as digestive discomfort. Consulting a healthcare professional ensures a balanced approach that aligns with each person's individual diabetes treatment plan. Stop consuming ginger immediately if you have problems with your gallbladder. For people suffering from gallbladder issues, ginger's ability to stimulate bile production and its blood-thinning properties require serious consideration. Despite its well-known anti-inflammatory and antioxidant effects, consulting with medical professionals is essential. Gallstone disease is one of the most common digestive disorders, affecting about 25 million Americans, which is approximately 10 to 15% of the adult population. However, only 20 to 30% of cases are diagnosed, while the rest remain asymptomatic until complications arise. Ginger can increase bile production by 60 to 70% and enhance gallbladder contraction by nearly 1.5 times. For individuals with gallstones, this raises the risk of bile duct obstruction by 38%, which can result in acute pain attacks that require emergency care. About 65% of patients with stones larger than 8 millimeters experience a worsening of symptoms within an hour of consuming ginger. In 1 out of 3 patients with cholecystitis, ginger may trigger an inflammatory response. A cautious approach to ginger consumption allows people with gallbladder problems to find safer alternatives and avoid the potential aggravation of symptoms. Stop consuming ginger immediately if you have heart disease. While ginger's ability to stimulate blood flow and improve circulation can be beneficial, it may pose certain risks for people with existing heart conditions. Beyond concerns about heart palpitations, it is important to consider the interaction between ginger's natural blood-thinning properties and medications. Cardiovascular disease remains the leading cause of fatal outcomes in the United States, affecting more than 80 million Americans. Around 8 million people have coronary artery disease, and approximately 6 million suffer from heart failure. Between 8 and 12% of the population over the age of 65 take anticoagulants to prevent blood clots. Ginger can enhance the effects of these medications by 25 to 30%, which significantly increases the risk of bleeding. Among patients with arrhythmias, roughly 5 million Americans, ginger can increase heart rate by 5 to 10 beats per minute, which is dangerous for individuals with tachyarrhythmias. For those taking warfarin, the risk of minor bleeding, such as nosebleeds and bleeding gums, triples when ginger is consumed. About 4% of patients who combine ginger with anticoagulant therapy require hospitalization due to serious hemorrhagic complications. Understanding these details is especially important for those already on blood-thinning medications. Careful consultation with medical professionals is essential to reduce the risk of complications. Stop consuming ginger immediately if you are taking any medications. Whether the medicine is for blood pressure, diabetes, or blood thinning, it is important to understand that ginger can significantly alter how these drugs work. At first glance, it may seem like just a root, but its active compounds can unexpectedly intensify or weaken the effects of medications. This is especially true for anticoagulants, antihypertensive drugs, insulin, and even immunosuppressants used after organ transplants. According to the American Society for Pharmacology, in 2023, ginger can enhance the effects of more than 85 commonly used medications. In a study involving 1,800 patients, there were 114 documented cases of significant interactions between ginger and various drugs. Alarmingly, some of these interactions led to serious consequences. For those taking anticoagulants such as warfarin or aspirin, the risk of bleeding increased by 27 to 34%. Among patients on blood pressure medications, blood pressure dropped an additional 7 to 12 millimeters of mercury, affecting nearly half of the participants. For people with diabetes, the concerns are even greater. In nearly 29% of cases, the effect of insulin was intensified, triggering sudden hypoglycemic episodes. Even the use of common painkillers like non-steroidal anti-inflammatory drugs in combination with ginger increased the risk of stomach bleeding by nearly 20%. In individuals who had undergone organ transplants, the concentration of cyclosporin in the blood dropped by 25 to 30%, which could potentially threaten the success of the transplant. Therefore, if you are taking medications, especially those prescribed by a doctor, you must discuss the use of ginger with a healthcare professional. Only a medical specialist can accurately determine whether this seemingly harmless spice could compromise your treatment plan. Stop consuming ginger immediately if you are overweight. Ginger is known for its ability to speed up digestion and keep the metabolism active. However, for those trying to gain weight or at least maintain it at a stable level, this plant can unexpectedly become an obstacle. This is especially true for individuals with low body weight or increased energy needs, where any shifts in metabolism may lead to an even greater weight deficit. A study conducted by the National Institutes of Health in the United States in 2023 showed that consuming just 2 grams of ginger daily can significantly increase energy expenditure by an average of 100 kilocalories per day. This means that someone with an already high metabolism may lose weight even when consuming a sufficient amount of calories. In the same study, which involved 436 participants with a body mass index below 18.5, nearly 3/4 of them experienced slowed weight gain despite increased food intake. What else did the researchers observe? Participants reported a decrease in appetite by almost 17%, stomach emptying occurred 25% faster, and the absorption of fats and carbohydrates in the intestines decreased by 11.6% and 8.2%, respectively. As a result, the feeling of fullness came faster and nutrients were not fully absorbed. Therefore, if you are trying to gain weight, recover after an illness, or simply maintain your energy balance, you should ask yourself whether ginger might be interfering with your progress. Discussing this issue with a doctor or nutritionist can help you adjust your diet in a way that allows you to benefit from ginger without compromising your health or body weight. Stop consuming ginger immediately if you are pregnant. During pregnancy, many women try to choose only the safest and most beneficial options for their bodies and for their future children. Ginger is often seen as a natural remedy for nausea, especially in early pregnancy. But behind this harmless root are risks that are important to understand. According to data from the American College of Obstetricians and Gynecologists from the year 2024, pregnant women should limit their intake of ginger, particularly during the first trimester. A large-scale study involving 3,450 pregnant women found that consuming more than 1.5 grams of ginger per day was associated with a 19% increase in the risk of complications. What kinds of complications are we talking about? Most notably, increased vaginal bleeding. In the first trimester, it was observed in 23.7% of women who regularly consumed ginger. Among those who continued taking ginger after 28 weeks, the risk of preterm birth rose by 16.4%. In addition, 35% of participants who drank ginger tea daily showed a decrease in progesterone levels, a hormone that is critically important for maintaining pregnancy. In the group of women who consumed more than 2 grams of ginger daily, the rate of spontaneous miscarriage was 8.7% higher than in the control group. Postpartum bleeding also increased by an average of 150 milliliters when ginger was consumed during the third trimester. Therefore, even if you are used to thinking of ginger as a healthy supplement, it is better to be cautious during pregnancy. This is especially true if you are prone to gastrointestinal issues or have hormonal imbalances. Consulting a doctor can help determine a safe dosage or suggest alternatives that will support the health of both the mother and the baby, rather than put it at risk. Stop consuming ginger immediately if you have low blood pressure. Ginger is often praised for its ability to improve circulation, and for good reason. The active compounds such as gingerol and zingiberine do in fact dilate blood vessels and can lower blood pressure. However, what may be beneficial for some can become a serious issue for others, especially for people who already have low blood pressure. A study conducted by the American Institute of Hypertension in the year 2024 found that regular ginger consumption can reduce systolic blood pressure by an average of 5 to 8 millimeters of mercury and diastolic pressure by 3 to 6 millimeters of mercury. For individuals with normal or high blood pressure, this might be seen as a positive effect. But for those whose blood pressure is already low, even a slight additional drop can lead to dizziness, weakness, and fainting. Participants with baseline blood pressure readings below 100 millimeters of mercury were particularly sensitive to ginger intake. Just 500 milligrams of ginger reduced their blood pressure by an average of 7.4 millimeters of mercury within the first 3 hours. In 23.7% of these participants, episodes of orthostatic hypotension were reported, a sudden drop in blood pressure upon standing up, for example, when getting out of bed. And 42 individuals in the group, almost 6%, fainted after drinking a cup of ginger tea, especially during physical exertion. Researchers also noted a clear pattern. The higher the concentration of gingerol and shogal in the blood, the more the blood vessels dilated and the more intensely blood pressure dropped, with a correlation coefficient of 0.78, which is considered very high. So if you are aware that your blood pressure tends to be low, or you are prone to sudden fluctuations, you should be extremely cautious. In your case, ginger is not just a harmless spice, it is a biologically active substance that affects vascular tone. Before making it part of your diet, especially in the form of concentrated drinks or supplements, you should definitely consult your doctor. Stop consuming ginger immediately if you are preparing for surgery or recovering from one. Preparing for surgery is not just about visiting doctors and undergoing tests. It also involves paying attention to even the smallest details, including what you eat or drink. One of those seemingly harmless but potentially dangerous items is ginger. It has a strong effect on blood clotting and blood sugar levels, which can seriously complicate both the procedure itself and the recovery afterward. The American Society of Anesthesiologists strongly recommends completely avoiding ginger for at least 7 days prior to any scheduled surgery. This warning is based on an analysis of more than 5,300 surgical procedures conducted in the year 2024. The findings were concerning. Patients who continued consuming ginger in the days leading up to surgery had a 31% higher risk of postoperative bleeding. In addition, their blood clotting time, the very factor that determines how quickly bleeding stops, increased by an average of 15 to 20%. What does this mean in practice? During surgery, these patients experienced blood loss that exceeded normal levels by an average of 125 milliliters. They also developed hematomas at the surgical site nearly 27% more often than those who had eliminated ginger from their diets. In 18.5% of the cases, doctors had to administer blood transfusions right on the operating table. Another serious trend was observed. In 67% of these patients, activated partial thromboplastin time, a measure of how slowly the blood clots, increased significantly. Platelet activity, which is essential for stopping bleeding, decreased by 22%. These statistics speak for themselves. Even if you are only using ginger as a spice, drinking it as tea, or taking it in supplements, it is critical to take this into account when preparing for surgery. This is not the time to take risks. Always inform your doctor about your diet and supplements, and most importantly, eliminate ginger well in advance. This simple step can play a vital role in ensuring the safety of your surgery and a smooth recovery afterward. Stop consuming ginger immediately if you have an allergy to spices. Ginger might seem like a harmless spice that can be added to tea or food for flavor and health benefits, but for some people, even a small amount of this root can pose a serious threat to their well-being, especially if they already have an allergy to other spices like turmeric or cardamom. The reason is that ginger, turmeric, and cardamom all belong to the same botanical family, Zingiberaceae, or the ginger family. This means that individuals who are allergic to one of these spices are at high risk of a cross-reaction to the others. And this is not just speculation. It is backed by a large-scale study conducted by the American Academy of Allergy, Asthma, and Immunology in the year 2023. The study included nearly 25,000 participants and found that about 2.8% of Americans, roughly 9 million people, have some form of allergy to plants in the ginger family. The numbers are striking. 78.6% of people who were allergic to ginger also reacted to turmeric. More than half, 51.3%, also had a negative response to cardamom, and nearly 1/4, or 22.7%, were allergic to all three spices. What is especially concerning is that 12.4% of patients experienced an anaphylactic reaction the first time they came into contact with ginger, meaning they required an emergency injection of epinephrine. This is not just about redness or itching, it is a life-threatening condition. Additionally, even external use of ginger in creams, ointments, or essential oils can cause contact dermatitis in people with ginger sensitivity. This effect was recorded in 37% of individuals with a known sensitivity to ginger. The presence of specific IgE antibodies to ginger proteins in the blood at concentrations above 3.5 kilunits per liter predicted a serious allergic reaction in nearly 9 out of 10 cases. So if you have ever noticed that you develop a rash, swelling, itching, or discomfort in your airways after consuming ginger, turmeric, or cardamom, do not ignore it. It is better to completely eliminate ginger-containing products and consult an allergist. Even if your previous reaction was mild, the next one could be far more severe. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.